when you do an ACL reconstruction, there are a couple kind of grafts that you can use. Can you explain those to me?
Except for the very, very young patient, which is extraordinary, we are unable to sew back the torn ACL. So we have to come up with a substitute, and that's what we call a reconstruction. When we do an ACL reconstruction, we have to use a graft to provide a new ACL, basically. There are three options to that. The two most common are using the patellar tendon, which is right from the front of the knee. The other is using the hamstring graft, which we take from the front of the knee, but actually comes from the back. These have both been used for over 20 years, and certainly some surgeons favor one over the other, but historically the results have been very equivalent. There are specific reasons to do one or the other, and those have to be sorted out between the patient and the doctor. The other option that is there, perhaps not often used for the young active person that we're talking about, is to use a cadaver graft. In my practice, that seems to fit a little bit more appropriately for the older patient who is working, whether he or she has to get back to work promptly. Perhaps the early recovery using a cadaver graft is faster, a little bit less painful, but there are also issues, global issues, about how many of these grafts do we have available. So for the young student, athlete or not, if we're talking surgery, in my practice, the cadaver graft is not often an option.